Welcome to this video, which was made by the Southwark Enhanced Intervention Service. Today's video is focusing on Positive Behaviour Support, also known as PBS. We will be discussing what challenging behaviour is, what PBS is, and the key components of PBS, the assessment, the formulation, and the PBS plan. Challenging behaviour, or behaviour that challenges, is defined as culturally abnormal behaviours of such an intensity, frequency, or duration that the physical safety of the person or others is likely to be placed in serious jeopardy, or behaviour which is likely to seriously limit use of or result in the person being denied access to ordinary community facilities. There is no set type of challenging behaviour. It is unique to an individual and can mean different things for different people. The term challenging behaviour is not intended to be a diagnosis or a label. Challenging behaviour always has a function, which means there is a reason the person engages in the behaviour. Challenging behaviour can take many forms, including the person you are supporting hurting themselves, also known as self-injurious behaviour, hurting other people, being verbally aggressive, displaying inappropriate behaviour or risky behaviour such as sexualised behaviour, or putting their hands in very hot water, or anything else that has a serious impact on their day-to-day life.
While challenging behaviour can be distressing for everyone, individuals with learning disabilities and/or autism often engage in challenging behaviour when something is not right. This can be a result of a mismatch between their physical and/or social environment and their needs, or when their health needs have not been met, for example, if they are feeling sick, constipated, or experiencing toothache. It can sometimes be helpful to think of challenging behaviour as a way of communicating. But using behaviour as a form of communication is not specific to individuals with a learning disability and/or autism. We all have the potential to engage in challenging behaviour. Just think how irritable and snappy you may get when you feel ill or are in pain. As we said earlier, all challenging behaviour has a function. There are 4 primary reasons why individuals may engage in challenging behaviour. These are to seek sensory stimulation, for example, touch, smell, vision, taste, noise, or movement. To escape or avoid something, for example, an activity, a demand, or a negative emotion such as anxiety. To seek social interaction or get access to care, for example, to get their attachment needs met. And to get a tangible object or access to an activity, for example, getting access to food, drink, or an activity.
The main aim of PBS is to improve the overall quality of life of the individual you are supporting and their support system. The reduction in behaviour should go hand in hand with this. What constitutes good quality of life is different for everyone, and everyone will have different things that are important to them. Take a moment to think about these 3 questions. What constitutes good quality of life for you? What constitutes good quality of life for the person you are supporting? What is the impact of the challenging behaviour on the quality of life for the person you are supporting and you? You can pause the video now to note down your thoughts. Take as much time as you need. Some of the common ways challenging behaviour impacts the quality of life for the person you are supporting includes not having their needs or desires met, being excluded from community activities, education or peer activities, side effects of medications they're prescribed, being subjected to any physical intervention that is necessary, having reduced community access, having experienced a placement breakdown, or having a reduced capacity to make choices and be independent. And some of the common ways challenging behaviour impacts the quality of life for the person supporting the individual with learning disabilities includes stress, burnout, isolation, having no time for oneself, sustaining injury as a result of the challenging behaviour, having an additional strain placed on their relationship, either with a parent, other children, parents, employers or friends, and experiencing a placement breakdown for the people supporting the individual whereby the supporter is left feeling uncertain about what's going to happen and doesn't feel safe in their environment.
Positive Behaviour Support, or PBS, is the recommended approach for supporting people who display behaviours that challenge. It is evidence-based and should be the first line of intervention. PBS aims to understand the functions of an individual's challenging behaviour so that their needs can be met in a proactive, safer way that is respectful, dignified, and ethical. It puts the person at the centre to make systems work for them and is guided by the individual and their unique needs, ensuring that the right support is given at the right time so that they can thrive to their potential and develop support strategies to improve the quality of life for themselves, those supporting them, while reducing challenging behaviours and the restrictions placed on them. A good PBS should consist of 10 key components. 1. Focus on improving quality of life, inclusion, participation, and support valued social roles. 2. Working to develop and build skills, not by punishing people or behaviour. 3. Having professionals work in partnership with the individuals and the people who are important to them. 4. Understanding that all behaviour is for a reason and that challenging behaviour is no different. 5. Using the principles of behaviour analysis to describe, predict, and change behaviour. 6. Including other complementary evidence-based approaches in the plan, such as occupational therapy and speech and language, and other psychological therapies that support changes in behaviour. 7. Making decisions based on facts, evidence, and research, not on opinions and hearsay. 8. Completing a formal assessment to understand the functions of the behaviour, then make a clear, structured plan of action so that the plan is directly informed by what they know about the individual and the behaviour. 9. The PBS plan explains what to do proactively to prevent episodes of challenging behaviour and how to reactively manage the behaviours if they do occur. And 10. It should make sure that people are actively supported over the long term to maintain their quality of life. Let's move on to talk about the PBS process in some more detail. In working out why the behaviour occurs, PBS specialists include the individual themselves, their family, carers, and other professionals. We work together to collect information to understand what the purpose of the behaviour is. We complete an assessment looking at various factors. We use assessment tools and outcome measures. We conduct interviews, complete observations, and review reports. We also ask people to complete ABC charts. For more information about the antecedents, behaviours, and consequences, please see our ABC chart video. We then develop a formulation from the assessment findings. This is a summary of why the behaviour happens within the context. And then a PBS plan is developed outlining the strategies that come from the formulation. Let's look at the assessment in some more detail.
During the assessment, there are several factors to consider when we're gathering information about the behaviour and starting to think about the function of the behaviour. As well as information about the behaviour, the antecedents, and the consequences, questions will also be asked about the individual context of the person, thinking about their strengths and their limitations, their diagnoses and what they mean for them and their interests. The person's relationship with others, including past and present individuals, thinking about whether these relationships were positive or negative, or if they have experienced a loss, for example, a regular known support worker leaving. We can also think about the person's environment, including past and present changes in the environment, what their home environment is like, if they are at school or college or have recently moved, or if there are any difficulties in their current placement or any other transitions happening. We should also think about other people's response to the challenging behaviour. For example, trying to identify if there is an emotional response connected to the behaviour, or if their behaviour has been historically reinforced over many years. And finally, it's important to look at if there are any underlying health issues, or health needs that the person you are supporting may not be able to express. For example, are they feeling unwell or in pain, or are they constipated? Please refer to our video on health needs for more information about the physical health needs of people with learning disabilities. When the assessment is completed, a formulation is developed. Let's look at what a formulation is. So what is a formulation? Well, it's basically like a map or a summary that captures and explains why a person engages in a behaviour within a context. It incorporates the person's personal context, that is, what factors of the person's diagnoses might be causing them difficulties. Do they have any physical health or mental health difficulties? Do they have any specific needs that factor into the behaviour? The person's environmental context. This includes the setting of the behaviour, the factors that contribute to the behaviour that are external to the person, the people who are supporting the person, any changes the person has experienced. The antecedents to the behaviour. That is, what happens before the behaviour and what triggers the behaviour. The behaviour itself. This is a description of what is seen, along with the duration and the intensity of the behaviour. The consequences of the behaviour. That is, what happens after the behaviour occurs. What does the person do, and what about people around them? What do they get from doing the behaviour? And finally, the function of the behaviour. What does the person get from engaging in that behaviour? This formulation will then guide us to helpful strategies that are detailed in the PBS plan. Let's think more about PBS plans.
As mentioned before, there are two types of strategies within a PBS plan. These are proactive and reactive strategies. Here are two examples of strategies. Can you tell which one is a proactive strategy and which is a reactive strategy? We'll give you a few seconds to decide. This is a proactive strategy, and this is a reactive strategy. Let's look at the difference. Proactive strategies are things to do every day when supporting the person to improve their quality of life and meet their needs so that they do not have to engage in the behaviours that challenge. These strategies aim to reduce anxiety-provoking situations and therefore the person's feelings of anxiety and distress. They are strategies for long-term change and can include changing the environment, physical and social, teaching skills and reinforcing positive behaviours with the aim of increasing quality of life. They are often categorised into 5 overarching types. Tailoring your communication to meet the level of the person. Trying to ensure routine and structure. Engaging the individual you support in meaningful activities and positive social interactions. Skills teaching. And changing the physical environment to avoid any anxiety-provoking triggers and to meet the person's needs. Reactive strategies are things that should be done after the behaviour has occurred. They are strategies that enable immediate response to a behaviour to de-escalate the person you are supporting and to remove the trigger or meet the need or desire of the person. They aim to minimise the risk in the moment and keep everyone safe. They can be categorised into 4 overarching types. Changing your communication to get onto the level of the person you are supporting. This may need to be different from the way that you usually interact with them. Trying to meet the needs or desires of the individual you are supporting, although you will need to keep in mind that you do not want to reinforce the behaviour. Redirecting the person you are supporting to preferred, relaxing or soothing activity. This will likely need to be something low demand. And again, adapting the environment to make it safe, low demand or low arousal. Most PBS plans also include secondary strategies. Secondary strategies are things to do to avoid an escalation of behaviour. They are things to do when you start to see the person you are supporting getting upset or anxious, when you start to see the early warning signs.
Let's look at some examples of proactive strategies. Remember, these are the things to do every day to effectively support the person and improve their quality of life. A good PBS plan will include strategies about how best to communicate with the person. For example, what words, signs and symbols they can understand. It will also include information on specific supports they need, for example visual support such as a daily visual schedule, and how the person can make choices, for example visually from 2 options. A good PBS plan will also include strategies focused on developing a routine and structure for the person. This might include strategies such as having a consistent routine with minimal changes, warning people if there'll be a change, and supporting the individual you are working with using visual schedules, such as a weekly or daily timetable and a now and next board. A good PBS plan will focus on how you can support the person to have meaningful engagement in activities and positive social interactions. Examples of such strategies may be ensuring you interact with the person and spend quality time together throughout the day, and providing a variety of activities both in the community and at home. PBS plans often have strategies focused on skills teaching to support the person to become more independent. Examples of such strategies include breaking down tasks into small, manageable chunks and teaching people new skills to replace the behaviours that challenge. For example, a sign to ask for something rather than using a behaviour to get that thing. And finally, a good PBS plan will include strategies on how to manage the environment around the person so it is capable and meets their needs. Examples of such strategies might include controlling the temperature of the environment, the space, the number of people present, the noise levels, the lighting, and any other factors that could influence the sensory needs of the person you are supporting. But remember, each individual's PBS plan will have different proactive strategies as they are based on the formulation of their behaviour, which occurs within a context, so they are unique to them. Now let's look at the secondary strategies. These are the things you should do once the person you are supporting is becoming anxious or upset and displaying the early warning signs. These strategies will be different for each individual as they are based on the formulation of the behaviour within the context. This is why it is important to know the individual you're supporting well. The PBS plan will outline what early warning signs you should look for and then what you should do when you see them. Examples of these strategies include meeting someone's requests sooner rather than later if possible, supporting redirection, for example by offering an alternative preferred activity to redirect and distract them if you are unable to meet their requests, and only offering options that are available. Supporting the person to engage in calming activities, for example by providing activities that reduce or stimulate sensory input, such as massage or weighted blankets. And also removing whatever is triggering the person to be upset and anxious, or removing them from the environment. But remember, these will be different for every individual. Now let's look at the reactive strategies. Remember, these are the things you should do once the person is engaging in the behaviour that is challenging. When implementing the reactive strategies, consistency is key. The PBS plan should outline how you should communicate with someone once the behaviour has been displayed. Examples of communication as a reactive strategy might include reducing the demands placed on the individual you're supporting, giving them less verbal communication and more signs or symbols, or using very clear and calm, limited verbal communication. The PBS plan will also outline what else to do. This might include how you might meet the needs or desires of the people you're supporting. For example, this might be to remove the trigger to the behaviour, or meet any appropriate requests sooner rather than later. It may also include how to use redirection, for example offering an alternative activity to redirect and distract the person, or offering calming activities such as listening to music or relaxing massage. It may also include how you can adapt the environment to reduce the risk. This may include things such as removing items that could be thrown or damaged, and where you should position yourself and others. Sometimes it's easier to develop a flowchart or use the 5-point check-in to help you decide what to do. For more information about the 5-point check-in, please see our Understanding Learning Disabilities and Autism video. A flowchart can help you in key decision-making when you are responding to an incident, but should be tailored and detailed to the individual you are supporting. And again, remember that the reactive strategies that are in the PBS plan will be different for each individual. because they're based on the formulation of the behaviour within the context and are unique to the individual and the context.
It is important to highlight that a good PBS plan will include far more proactive strategies compared to secondary and reactive strategies. That is because if all the proactive strategies are implemented consistently, there should be less need for the secondary and reactive strategies. It is also important to remember that sometimes less is more and consistency is key, which is why we support families and providers to implement the plan consistently through training and modelling strategies, observing, and by providing feedback. So, to summarise what we have learnt today, positive behaviour support is a recommended first-line approach for behaviours that challenge. PBS is focused on quality of life with reduction of behaviour that challenges as a consequence of increasing quality of life. PBS assessment looks at the person's personal context and environmental context, as well as the B's and the C's, the antecedents to the behaviour and the consequences of the behaviour. The PBS formulation is developed to help us summarise this information and understand the function of the behaviour. The PBS plan is focused on proactive strategies to support the individual every day to increase their quality of life and decrease the B's and the C's. It also outlines secondary strategies to use once the early warning signs have been observed and reactive strategies to use once the person is engaging in the behaviour that is challenging. And finally, PBS is a process and consistency is key. Strategies may need to be tried and then adjusted, and everyone supporting the individual should follow the same plan.
This video is brought to you by the Southwark EIS.
We hope you found this video useful. If you'd like any more information, please do not hesitate to contact us.